Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. My name is Anissa Fira. I will presentation a journal about effect of lifetime stress exposure on mental and physical health in young adulthood. Background of the journal is life stress is strongly associated with poor mental and physical health. This affect except those of other well-known risk factors such as tobacco use, excessive alcohol consumption, and physical inactivity and account for substantial morbidity and mortality. Understanding how stress impact health and what factor mitigate this effect is as critically important. One of the most important advances in this area of research involves the recent adoption of a left-course perspective for studying stress and theorists now generally appreciate that stress occurring over the lifespan can have a cumulative effect on health. However, few studies have actually measured lifetime stress exposure and assessed the effect that such exposure on mental and physical health outcomes. This has occurred in part because no system has existed for measuring cumulative stress. Expert in efficient, cost-effective manner. One factor that may influence that effect that cumulative stress exposure has on health is forgiveness. Forgiveness is the release of negative and the potential enhancement of positive feelings, emotions, and behaviors toward an offender. One factor that might influence the fact that cumulative stress exposure has on health is forgiveness. Forgiveness is the release of the negative and the potential enhancement of positive feelings, emotions, and behaviors toward offender. Research has demonstrated that forgiveness is associated with several mental health outcomes, including less anxiety, depression, and other major psychiatric disorders. Forgiveness is also associated with better depression and other major psychiatric disorders. Forgiveness is also associated with better physical health in with physical profiles that underlie good health. In this context, forgiveness predicts favor physical health system, better overall physical health, healthier cardiovascular responses to stress, and lower rate of cardiovascular disease. As can be expected, forgiveness is thus also associated with lower rates of mortality. Studies have shown that perception of stress fully mediate association between forgiveness and mental and that perception of stress health physical health system and that forgiveness partially mediates the link between traumatic stress exposure and post-traumatic stress disorder system. In contrast to his mediational work, literature has examined with her forgiveness moderators or buffer association between stress and health, despite the fact that the traditional model and the adaptant stress and both mediators and moderators. Evidence suggests that reduction in stress perception may help explain why forgiveness is related to health. But to date, it's not known if forgiveness offers a protective benefit in the stress health equation, demonstrating a behavioral effect of forgiveness on stress related health system requires obedience of moderation. Finding of the journal is on average participant experienced nearly 30 major life stressors each and rate total stress as being moderately stressful. Participants report level of overall forgiveness that were relatively high and a moderate number of mental and physical health systems. The most frequently reported stressor involved keeping up with the demands of colleagues, that of a close friend or loved one, isolation and loneliness, and relationship difficulties and financial problems. In Wilfred's analysis, most of the 20 stress severity indices were strongly associated with poor health. Only reproductive, legal, or criminal death and death-related stressors were unrelated to health. Given the consistency across stress indices, subsequent analysis utilized total stress severity score has the majority. Total lifetime stressor severity was strongly associated with having more mental and physical health system. In contrast to stress, forgiveness we negatively relate to mental and physical health system. Additionally, greater lifetime stress severity was negatively related to forgiveness and respectively. As expected, participants experiencing more mental health system also experienced more physical health system. Primary analysis lifetime stress severity, forgiveness, and mental health. As hypothesized, forgiveness significantly moderated the effect of lifetime stress severity on mental health. Planned simple slopes analysis revealed and graded moderating effect of forgiveness on mental health system. Specifically, participants with low levels of forgiveness showed the strongest association between lifetime stress severity and mental health system, followed by participants exhibiting moderate amount of forgiveness, and finally by participants with high level of forgiveness. Also, as hypothesized, lifetime stressor severity and forgiveness were but unequally associated with mental health system. With greater lifetime stress severity prediction, more mental health system, and higher level of forgiveness predicting favor mental health system, lifetime stress severity, forgiveness, and physical health. Next, lifetime stress severity, forgiveness, and physical health. Next, the effect of lifetime stress severity and forgiveness on physical health system were examined. Contrary to our hypothesis, forgiveness did not moderate the effect of cumulative lifetime stress severity on physical health in hypothesis. Lifetime stressor severity and forgiveness were but unequally associated with physical health system. With greater lifetime stress severity prediction, more physical health system, and high level of forgiveness prediction, fewer system. Conclusion of the journal is the stressor count and severity correlation exceeds 95. This occurs because stressor severity scores are based in part on how many stressor participants experience. Severity was used as the stress measure in this study, although results are virtually identical using stress on count or severity. Mental health was controlled for in model of physical health and vice versa. Results remain virtual action as a result of inclusion or exclusion of the covariate. The fact that forgiveness did not moderate of the effect of stress on physical health was not likely to. Another possible reason for the contrasting pattern of results for mental and physical health may involve the fact that a talk participant experience a provocamentally 30 different stressors. The stressors may not exert effect on physical health then are readily mitigated by forgiveness. This possibility is consistent with the goodness of it hypothesis, which suggests that a person's coping style must be relevant and useful for dealing with the type of stress experienced for the method to confer health benefit. That is my presentation. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.